Thank you. Good afternoon, everyone. Thank you all so much for allowing me to do this. So I am going to be relatively quick because I just remembered another event that I need to attend to. So I am going to talk specifically about diabetes. So just by show of hands, how many of us are either diabetic, has a close family member who is diabetic? Yeah, just those two. You're either diabetic or have a close family member that is diabetic. And you can just do the thumbs up, hands up, so that I can see those with picture, right? So the data shows that diabetes is actually one of the leading causes of death and disability in most of our communities. And because it's one of the leading causes of death and disability, I thought it's important for us to talk about it, but in a way that we may not have talked about it before. What does that mean? I think that part of the reason why we are not doing as well as it comes to preventing or treating diabetes is because in many instances, we don't understand what the disease is. So let's start there. And I'm going to ask you to, anyone can unmute or type in the chat, what is diabetes? I mean, it's a word we throw around, but what does that word mean? So I'm seeing diabetes means your body cannot produce insulin to control sugar, too much sugar in your body. Someone was unmuting, go ahead.
You have, wait, are you hearing me?
Yes.
The pancreas is not working properly.
The pancreas
to,
is...
To metabolize the insulin in your body.
Okay. All right, so we have several things happening. When we eat food, one of the nutrients that the food breaks down to is what we would call sugar. Glucose is the official name, but let's just say sugar. The way our body works is when that food goes into our mouths, we eat it, we digest it, it goes into our it goes into our stomach, our large intestines, and then our small intestines. It then gets into our blood, right? So the glucose, the sugar, is running around in our blood. What most people don't recognize is that the sugar that is running around in our blood needs help to actually get to our organs. And so we're talking about getting to our heart, getting to our lungs, getting to our muscles so that we move, getting to everywhere that needs the nutrients. The fact that you have eaten the food that has a sugar does not mean that it automatically goes into your cells. The thing that allows the sugar to move into your cells is insulin. And insulin is the hormone that is produced and excreted from your pancreas. So the insulin works kind of like a key. You know, you have to put in a key into a lock to open the door. There is a door that needs to be opened to get the sugar from your blood into your organs or into your cells. Insulin is basically the key that we need to turn the lock to allow the door to open for the sugar to get from your blood into your cells where it needs to be. If we have a situation though, where our body is not making the amount of insulin that we need, or our body is not making insulin at all, that is what we consider as childhood or type 1 diabetes, where the body is fighting against each other, fighting against itself, and it is not making the insulin. So you don't have it, type 1 or type 1 or childhood diabetes. Or what is more common is type 2, which is the body is making the insulin and all, but for whatever reason, it is not able to use it. It is not able to use it to open the door to let the sugar in. There's a third type of diabetes that is gestational, which is you've been fine before. You would, your body was fine, and then you got pregnant, and suddenly this whole system isn't working the way it should. So it is only because you are pregnant why it is not working. Now, what is one of the first things they tell you to do if you have been identified as being diabetic? Tell me. Usually you're like me and you got a little fluffy. What do they
Reduce
do?
sugar intake.
Right. So one of the things they tell you to do is to watch your sugar intake, because if you have less sugar coming into your system, or let me not say less sugar, because in many instances, what we eat on a regular basis is actually way too much sugar than what our body needs. So when we're talking about less sugar intake, we are really saying to limit how much we are intaking, because how much we are intaking is way too much for what our body needs. So yes, they tell us to limit the sugar intake, because if you have less sugar in your blood, then there is less work for your body to do to get rid of the sugar that's in your blood to get it into your system. What else do they tell you to do? What is one of the other things that the doctor or the nurse or the nutritionist tells you to do, other than managing your diet?
Working out or exercise?
Yes.
Mobility, more mobility.
They tell you to be more mobile. And one of the reasons they tell you to be more mobile or to lose weight in many instances, because many of us are overweight, it is actually because fat cells is actually one of the things that prevents the insulin from getting into the keyhole to be able to unlock the door. All right. So the fat cells that have been building up in your body is actually preventing the insulin from doing what it needs to do, which is why they frequently say, if you are at the diabetic stage or even pre-diabetes, one of the first things they tell you to do is to change your diet, one, and increase your mobility, two, so that you can decrease the amount of fat that is in your body. Now, I'm using this method because I know that these lifestyle diseases are really lifestyle diseases, because a change in your lifestyle is what it takes to make you better or to prevent you from getting ill. And I wanted to specifically highlight the issue of weight loss and fat and sugar intake, because those are the things that we can actually control as human beings. And those are the things that if we are able to do them and to do them effectively, we can actually move from being diabetic or pre-diabetic back to down to normal blood glucose numbers. Now that takes a little bit of time and that takes a little bit of effort. And I'm actually really glad that Salia took the time before me to talk about this kind of this way that we need to think about our lives being holistically well to be able to do all of these things. Because the fact remains, if we are not emotionally well, it is difficult to get up and to go for that 5 a.m. walk. If our jobs are not satisfying and we literally hate to get up and go to work every single day, then it's hard to add exercising to the thing you need to do. If you have to worry about getting money to eat or to mind your children or to, whatever it is, it is difficult to think about buying the healthy food or to exercise. If you live in a community where the environment is unsafe, it's hard to get up and walk because you are literally thinking about whether you will die out there going for a walk. So I thought that it was important for us to really understand how diabetes work, so that when you hear the advice from the health professionals, it is based on actual science. And even though we are telling you to do the simple things of get up and exercise or eat differently or so forth, we do understand that those simple things may actually be pretty difficult depending on what else is happening around you and depending on what else is happening in your life. Some of the things that happen when we are diabetic includes the fact that we get very, very thirsty, and we have to go to the bathroom every so often, way more than normal. Why is that the case? So if you go back to what happens when the insulin is working, the insulin works, it unlocks the door opens, sugar goes from your blood into your cells. Your body is then able to use the energy that is in the glucose, that is in the sugar. If that door remains closed though, and you keep eating and you keep just doing normal things, then the amount of sugar that is in your blood keeps building. Now, our body is regulated to ensure, and I think it's a word we used before, homeostasis, meaning there is need for a balance. Our body knows that the sugar content should be this amount, so you will do what it takes to get rid of the sugar. The salt content, the protein content, the whatever should be a particular amount within a range, so the body then goes into overdrive to get it back to that range. How does the body deal with a lot of sugar in your blood? The kidneys then kick in. And the kidneys kick in to try to get as much liquid that will pull the sugar out of your body in the form of urine, which is why one of the ways we can test for diabetes is to test your urine, because literally when you have too much sugar in your blood, the sugar actually is pulled through the kidneys into your urine, and you can actually test the urine for actual sugar. By the way, one of the, now I don't know if this is true or not. It's something that I've heard more than one person say. So I will repeat it here as if it is truth. I've been told that one of the ways that people would recognize diabetics before the advent of modern medicine is when they actually go and pee outside in the yard. That ants will be around the urine because of the volume of sugar that is actually within the urine. Ants just follow your urine. And that was one of the ways back then of highlighting, saying, okay, something is going on with this person. So no, we don't have the fancy sticks or the things to test, but the fact that ants running behind your sugar, behind your pee, your urine is sweet. Is an indication that you have diabetes. So that's one of the reasons, or that is the main reason why you will continue to feel thirsty, because your kidneys are trying its best to pull the sugar out. And the way the kidneys work to do that is to pull the sugar out with liquid, to get it out of your system, which means that you are now dehydrated because the amount of water that is in your body is now less than it should be. And the way the body says to your brain, let's get back to that state of homeostasis, to that state of balance, is drink more water. The same thing applies with why you find yourself being hungry and tired. Remember, the sugar that is in your blood needs to get into your cells for your cells to work. If your cells don't get the sugar, then your cells are hungry. So diabetes is actually a state where you have nutrients in your body, in your blood, but the nutrients are not getting to the cells where they need to be. So you are hungry, you are filled, you have a lot of nutrients, yet your cells are starving. And imagine being in that state all the time, how much that is affecting everything else that is happening to you. Because you're hungry. Your body is telling you, your cells are telling you, I am starving. But when you look at your blood sugar is way high because the sugar that is in your blood is not making its way into your cells at all, which is where they need to be. The other thing that happens is you have numbness in your hands, in your fingers, in your toes. And it's because, again, the sugar is not getting to the nervous system that is supposed to tell the rest of your body, there is something happening at my fingers, or there is something happening at my toes. And the kind of response that we should be getting, we're not getting it. The same applies to having a cut that is not healing. A big chunk of the healing process is cells doing what they are supposed to do. And if those cells are hungry, they can't do what they are supposed to do, which is initiate the healing process that is required. So you recognize that because you simply do not have that key that opens a simple door, the entire system goes out of whack. And you end up with all of these symptoms. You end up with all of these parts of your body that are not working the way they should. And because all of these parts of your body are not working the way you should, you end up with, for example, blindness. You end up with, for example, kidney disease. Many of our dialysis patients are diabetic because remember, part of your body trying to save itself is your kidneys trying to deal with the madness that's going on in your blood. And if it can't do that, it then damages the kidneys themselves. And remember, the kidneys are actually one of the cells, one of the organs that also needs the energy from the glucose, and it can't get it. So you recognize that all of these things happening to you, you go to the doctor, and then the doctor tells you to do what may seem to be two of the easiest things, but are two of the most difficult things, which is what's your diet and exercise. And again, if everything else in your life is not working or it's not in balance, it is so difficult to do those two things that the doctors are telling you to do. If you get to the point where you need to take medication, it is really, really critical for you to take the medication as prescribed and for you to monitor your glucose while you are taking the medication. Because there are two things that can happen. When you take the medication, you can have an immediate response where your blood sugar drops drastically. Usually, if you are taking insulin and you're taking insulin at night, there's usually a couple hours window where the insulin works, and you usually recognize that your glucose levels is ridiculously low very late at night, in some instances when you are asleep. My mother, for example, Lidmoy, is one who has been living with diabetes for over 30 years. As a matter of fact, as far back as I can remember, my mother has been diabetic. And one of the things that she does is she always has a bottle of something sweet with her, just in case she gets to the point where her sugar is very low, so she can regulate it quickly and bring it back up quickly. The opposite of that is if you are not taking the medication, which is the, whether it's the metformin or whatever the tablet is, or the insulin, which is the injectable, and your blood sugar continues to be sky high, that then results in practically all of your organs failing.
Faith,
All of
can I interrupt, Faith, just to ask you, what about something called a diabetic coma? I always hear people talk about that. How does that get caused?
Right. So what happens in a coma is that you are not conscious, right? So you are not conscious, and
It's just so low.
well, the diabetic coma, when we usually think of diabetic coma, is actually because the blood sugar is so very, very high, and it's continually high for a
High?
very, very long period. Yep.
The brain, I can add, so that the brain relies on glucose to function. So while some of our other organs and systems can use protein, can use fats as an energy source, the brain relies almost exclusively on glucose. So if you have diabetes and your brain is unable to utilize the glucose that's present in your bloodstream, then the response is like your nervous system shuts down, your brain shuts down. Okay. And so you think when you get into a diabetic coma, it's because, as Dr. Faith said, your blood sugar levels are sky high, and the response by your system is to shut down. Okay. And so you end up in a coma. When patients come into the hospital in a diabetic coma, you have to hydrate them, and you have to add insulin to their, just get the blood sugars down as quickly as possible. Sometimes they get into what is called diabetic ketoacidosis. So because the sugar is there, now your blood is becoming acidic, right? There's so many complications, but the remedy is as simple as diet and exercise. It's easier said than done.
And that's the hard part. The remedy is as simple as that and exercise, but easier said than done.
Easier said than done.
Which we're supposed to be doing anyway.
We are. Now we have to get to the point though. We have to figure out how to get to the point where you are making this decision for yourself. Because I think what frequently happens is we are forced to do it. The doctor says, the doctor comes in and scares you, kind of thing. And you do it for a little bit, but because you are not balanced in your thinking about it, you start hot and sweaty, or you start with some diet that is just so extreme that you cannot maintain it. And then you recognize after a while you fall off of both the diet and the exercise, and you are back to where you were before. So we have to figure out how to get to the point where we are making that decision for ourselves, because it is the right thing for ourselves, for our body. And again, that's why I was so happy that Celia did this session before, because all of that is the balance. It really, really has to be, because you need to understand in your mind that this is something that you need to do for you. And that is why I started with explaining how the sugar works and how the insulin works, so that you know when we say exercise or when we say diet, this is why. And it's not just because the doctor is being mean and doesn't want you to eat your ice cream that you love.
I have a quick question. What causes the body to stop being able to produce insulin? I mean, are there some specific reasons why it happens?
Right. So usually the body Type 1 diabetes is where the body is not producing the insulin, because it's almost like an autoimmune disease where the body is attacking itself and preventing the pancreas from producing the insulin that it needs to produce. I do not know that we truly understand why that happens. Go ahead, Salia.
So with type 1, the one that happens in children is because, yes, it's like an immune response. So like how you have lupus or, these autoimmune diseases where the body attacks itself. So the body starts attacking these cells in the pancreas that are producing insulin, and you're no longer able to produce insulin. So that's type 1, which is more prevalent in children. In type 2, it's called insulin resistance. And Dr. Faith mentioned fat cells, and you have fat cells that are not functioning the way that they normally should. But what happens in insulin resistance is your system, it's coupled sometimes with what's called an inflammatory process, so inflammation in your system. And this state of inflammation, this causes your tissue. So it's the fat cells, the muscle cells. These are the other cells that are usually responsive to insulin. They're no longer able to respond. And this is just some sort of inflammatory process that occurs within these tissues. So obesity has been described as an inflammatory process that it gets complicated. But just think, as someone gains weight, they move further and further away from this point of balance or homeostasis. So the body is less able to regulate itself as it should. And part of this is due to these inflammatory processes that are happening in your tissues and in your organs. And so because of this inflammation, the insulin is there. The insulin is secreted, but it's the cells just aren't responding to it. So the lock and key thing, the key is floating around, the lock is there, but somehow they're not fitting together and they're not able to do what they're supposed to do. And so sometimes then the pancreas then starts producing more insulin. It's like, maybe I didn't produce enough insulin, so I'll start producing more. So it produces more and more, and then it just burns out. And so eventually in type 2, the pancreas stops producing insulin as well. And that's when you need to start injecting yourself with insulin, because it's not working anymore. It's not even producing its own in order for the body to respond. I hope I didn't confuse it too much, but that's kind of what happens.
No, that's great. I didn't realize how much inflammation was part of this process. That's so important to know.
Yeah.
Because maybe some of us are not even overweight, but we have inflammation in our bodies, and that could affect us too.
Yeah.
Which is why I'm supposed to be eating and exercising well anyway.
Yep.
Noted.
And I see, who is that? Diane is saying, whoever wants to be a part of an exercise accountability tribe, WhatsApp her, so that you could be part of that tribe. So any other questions?
I think I want to add one thing. You mentioned, Dr. Faith, the organ dysfunction that happens in people with diabetes. So you have the blindness, you have the poor wound healing, you have all of these processes are related to circulation. And essentially what's happening is because there's so much sugar floating around in your bloodstream, it's now affecting the integrity of your blood vessels.
Yeah.
Right? And you know, as part of diabetes, your diabetes checkup regimen, your doctor usually checks on your cholesterol as well, right? And this is because with that process, you then have increased fat deposition, cholesterol deposition in your blood vessels. And this is what's increasing your risk of heart disease. So people with diabetes also have a high risk of getting heart attacks.
Yeah.
You know, MIs, myocardial infarction, where the fat is blocking the vessels in the heart and it shuts down. Strokes, because the blood vessels in the brain are being disrupted. Yes, Sherma mentioned strokes. Yes.
Mhm.
When the blood vessels in your tissues are disrupted, that's when wound healing is then disrupted. So your ability, when a normal person gets a cut, you bleed a little bit, it closes up, and then you cover it with a band-aid, or over time it heals. With diabetes, because the circulation is so poor, the body isn't able to bring the nutrients, it's not able to remove the waste products, it's not able to bring the healing factors that are necessary, that just happen automatically if you don't have diabetes, to that site. And so wound healing is disrupted as well. Your nerves, so people with diabetes lose feeling in the fingertips and in their toes, and that's why they say don't walk around without shoes on or socks on, right? Because you can get a cut on your foot, you're not looking at the sole of your feet, you get a cut on your foot, and because you're not feeling it, because of the nervous system isn't working as it should, yes, no feeling. So the wound healing is disrupted. So then this wound stays there and festers until it becomes gangrenous. Then you start leading to amputations, right? It's all finally linked, as Dr. Faith is saying. Diet and exercise is the key, and self-management is the key, which is, as a doctor and as a public health person, this is where the rubber meets the road. This is where the rubber meets the road. How do you get patients to do the simple things,
That we need you to do.
right? To do the simple things that are required. And it's a I think it's a song and dance. It's a back and forth. We have to work with each other to build that capacity, to work with patients where they are, to understand how can you start integrating these simple changes, making these healthy choices into your daily regimen. But
Yeah, just
Yeah,
as you
can I
said
say
that,
something?
I'm forced to say, so as a coach, I encourage communities, and the Job community is really lucky to have each other and to put this time aside to look at their health, and we can let it be the beginning of a proactive community. And as I said, as a coach, that's where I like to actually involve that, ignite that community behavior and keep that going, because that's a big plus. It's a big plus to get the diet and the exercise piece going. And as I have the floor, I want to thank Cora and Stephanie for curating these powerful women to
Yes,
address the
thank
health issue.
yeah. And I don't know if Cora is on the chat. I'm looking to
Yes,
see
and
if she
she's
might have-
she's
trying
here
to
and she has a
speak.
question.
Okay,
Auntie
here
Cora,
she
you're
is.
muted.
All right, good. Cora?
Auntie Cora, you're muted.
Okay, here she is.
I did use the reaction button because both Dr. Faith has to go, and I normally give lessons on Sunday, so I'm 1 hour behind time. So I would like to give a vote of thanks. Is Dr. Faith there? I'm not seeing her.
Yes,
there.
I am.
She's there.
But can
She's
I
there.
just say one quick thing before your vote of thanks?
Yeah.
And it is the family link to all of this. For whatever reason, and it's very detailed, very scientific, but we're not going to get into it. if any of your family members, any of your ancestors are diabetic or were diabetic, it means that you are more likely to be diabetic. And it means you then need to add an additional layer of protection on yourself to prevent it from going down through your generations as well. So I just wanted to add that one little part. Again, exercise, diet, follow the doctor's instructions, and I think we'll be good to go.
Yes,
it.
thank you.